So when you're able to make contact with one of the leads you've generated through your dental sleep medicine marketing campaign, let's say when you do make contact, that person says, hey, I just don't have time to talk right now. I'm really going through a lot. You can say, I completely understand. And I just want to be upfront with you. We don't even know if we're able to help you. So would you be opposed to scheduling a call at a later date for when you are available, where we can discuss, 5 to 7 minutes and see if we actually can help you? Really key, when you ask them, would you be opposed to this? They don't want to say, yes, I'm opposed to having another call, because they're trying to be kind. You're kind on the phone. They want to reciprocate that. So generally, they're not going to say, yes, I'm opposed to it. You're asking that in a very specific way on purpose. And then secondly, because you're giving the option of scheduling that call for a later date, they don't feel like they have to answer your questions immediately. So you're going to be much more likely to be able to reconnect with that person at a later date.